Good morning, everyone. Today we are going to discuss about musculoskeletal system. So the musculoskeletal system it is composed of the two words. One is muscles and as well as the skeleton. So muscles, you know very well. There are three types of muscles. So that's skeletal muscle. Then we can identify the cardiac muscle. Then the smooth muscles. Then skeleton, which is there are two different types of skeletons are there: exoskeleton and endoskeleton. So the humans we are having endoskeleton means the skeleton which is present inside. So you must know what is skeleton. So skeleton is made up of the bones. So all the 206 bones they are joined with each other or articulated with each other and forms the skeleton. Okay, so in the skeleton now we are looking at the skull means the bones which are present in the head region. Okay, so we are going to discuss in detail about this musculoskeletal system. Let me explain you one by one. Okay, so now we are seeing this. Yeah. So what is the main function? What is the main functions of this skeleton? Is it is main function is support, protection, movement, mineral homeostasis, blood cell production, and triglyceride storage. Apart of all these things, the main function of the skeleton is the weight transmission. Means the body weight is going to transmit into the ground. It is transmitted into the ground through the bones. So approximately a normal adult, his weighs about 50 to 60 kilograms in the normal adult, or sometimes it may be 70. Whatever it may be, the weight is going into the ground through the bones. The weight is transmitted from the body to the ground through the bones. Okay, through the bones and as well as through the joints. Now coming to the bone cells, what are the bone cells are present? Bone cells are categorized as osteoblasts, osteocytes, and osteoclasts. These are the three different bone cells are present. So immature cells are osteoblasts and osteocytes, which are present inside the space called as lacunae, and osteoclasts. So these are bone removing cells. Excess of bone is going to remove by this osteoclast cells. So coming to this next one is ossification or osteogenesis is the formation of bone by osteoblasts. This is nothing but the bone formation and growth that is called as ossification. Then coming to the once an osteoblast becomes surrounded by the bone matrix, it is referred to as an osteocyte. Okay, so when the bone cell is immature, it is called as osteoblast. When it is mature, it is called as osteocyte. Here we are looking at the osteocytes. Inside this pink color one, this space is called as a lacunae. Okay, then osteoclasts are bone destroying cells. Excess part of the bone is going to remove by this osteoclast cells. Okay, bone removing cells or bone destroying cells. Okay, then coming to the bone structure, there are two different parts are there in the bone. One is compact bone and cancellous bone. Or compact bone is also called as cortical bone, and cancellous bone it is also called as spongy bone. So coming to the compact bone, it is forms outer shell of the bone has a densely packed calcified intercellular matrix. Okay, so here you can see the compact bone. So the shaft part we can identify the compact bone. Then cancellous bone or spongy bone is found in the interior of the bones and is composed of trabeculae or spicules. If you just look at the upper end and the lower end of the long bones, we can identify this trabeculae and spicules. That is nothing but the spongy bone. Okay, so then coming to the bones can be classified according to the amount of bone matrix relative to the amount of space within the bone. Okay, spongy bone means upper end of the bone. It is consisting of interconnecting rods or plates of bone called as trabeculae. So this part it is called as trabeculae. Okay, so then coming to this compact bone, it is consists of mainly osteons. Osteons in the shaft. If we just take the shaft of the long bone and take section of it, then we can identify all the collagen fibers they are surrounded, they are present in the concentric fashion, means in a circular fashion. So this concentric fashion, they are called as lamellae. Lamellae. So the lamellae are nothing but the collagen fibers which are present in the circular fashion. So when the lamellae which is present outside or towards the periosteum, that is called as outer circumferential lamellae. The one which is present towards the bone marrow, that is called as endosteum, that is called as inner circumferential lamellae. Between the outer and the inner circumferential lamellae, we can identify the concentric fashion of the lamellae, that is called as concentric lamellae. In this lamellae, we can identify small spaces over here, the darkened areas. They are nothing but lacunae. The spaces are called as lacunae. In that lacunae, the mature bone cells, osteocytes, which are present over here. And every bone cell, it is having a bony projection, a bony, I mean, projections are there. They are called as canaliculi. Through that, they are communicating with each other. All the lacunae, they are communicating with each other through the lacunae. Okay, so that is about one concentric fashion of the lamellae. This part is called as osteon or Haversian system. It is consisting of one single central canal at the midline, then its contents are lamellae, lacunae, and osteocytes. Lamellae, lacunae, and osteocytes. Lamellae means collagen fibers. Lacunae means the spaces inside the lamellae. Then osteocytes means osteocytes which are present inside the lacunae. That is about the compact and the spongy bones. Then coming to the bone shapes, individual bones are classified according to the shape: long bones, flat bones, short bones, and irregular bones. So, in the most of the times in the examination purpose, if they ask the classification of the bones, you need to write according to the shape. It has been classified as long bones, flat bones, short bones, or irregular bones. Okay, short, long, flat, short, irregular, pneumatic, and sesamoid bones. I will explain you one by one. So the long bones are the bones of upper limb and the lower limb. Suppose when you see the bones of arm, bones of forearm, and coming to the bones of the thigh, bones of the leg. So here we are looking at a long bone called as the femur. This bone is a bone of thigh, bone of thigh. So it is a long bone. Coming to the flat bone, the skull bones we can identify. They are flat in nature, so they will come under the flat bone. An irregular bone, sphenoid bone, which is having a bad shaped bone, means it is irregular. Okay, so it is an example for irregular bone. Sphenoid bone, it is also an example for irregular bone. The short bones. So this in the carpal bones, you can identify very short bones are present. So the carpals and the tarsals, they will come under short bones. Then coming to this, the long bone, as I told you earlier, the upper end we can identify spongy bone. Okay, trabeculus we can identify over here. Then in the shaft, compact bone we can identify inside prominent medulla over here. So the shaft is going to divide into two areas: outer cortex and inner medulla. So outer surface of the bone is covered by a layer called as periosteum. Okay, periosteum is a layer which is covering the outer surface of the bone. Then here also we can identify long bones, short bones, irregular bones. So here we can let us see that in the skull bones, upper part we can identify the flat bones, in the face and all we can identify irregular bones. Then ribs also they will come under flat bones, and the vertebra, hip bone, and other bones of the skull, they will come under irregular bones. So then coming to this, minerals, what are the minerals are present in the bones? Calcium, magnesium, fluoride, and manganese. Okay, remember these four components. The main action of these four components you are going to study in the physiology and you are going to study in the biochemistry part. Okay, one is the calcium, which is responsible very much for the growth of the bone, and magnesium, it is helping for the extracellular, forming the extracellular matrix, and fluoride, it is strengthening the extracellular matrix, and manganese, which is activates the enzymes involved in the synthesis of the bone of extracellular matrix. Then coming to this nutrition, these are the vitamins which are essential for the growth of the bones. One is vitamin A, vitamin D, vitamin C, and vitamin K, and vitamin B12. Okay, So remember these four vitamins which are necessary for the bone growth. Then other hormones are which are responsible are growth hormone, which is secreted by the pituitary anterior pituitary gland, and then insulin like a growth factor. It promotes the normal bone growth. Thyroid hormone, which is required for the normal growth of all tissues. Then insulin, which promotes the normal bone growth by increasing the synthesis of bone proteins. Remember, you write four hormones, four vitamins, and four minerals. Then the other hormones, too, sex hormones in the parathyroid hormone. So the during the adult age, it promotes the sex hormone promotes the bone growth, and parathyroid hormone promotes the bone resorption by osteoclast, enhances recovery of calcium ions from urine. Okay, then coming to the last hormone is calcitonin. Okay, it is secreted by the thyroid gland, inhibits the bone resorption by osteoclasts. Then the exercise is also weight bearing activities stimulate osteoblasts and consequently help build thicker, stronger bones and retard loss of bone mass that occurs as a people age. Okay, so these are the structures we have to concentrate. Then other things we are going to see now. One by one, we'll see the bone remodeling. So bone remodeling, how it goes the bone remodeling. So first we can identify the epiphyseal growth and growth in length. In the epiphyseal growth we can identify the growth in cartilage, then it is surrounded by the epiphysis. You just remember the bone remodeling. When any bone got fractured, how it is going to form again, reform again. So first the cartilaginous cells they reaches over there and accumulates that part, and then slowly that cartilage part it is going to converts into the bone. Then bone healing. So first hematoma will happen. So that hematoma it is going to convert into the fibers and cartilage. In the second image you can identify. First you can identify the hematoma. Then after that it is going to convert into the fibers and the cartilage. Then slowly the cartilage is going to convert into the bone. So the callus formation will start forming at the second stage. So first, blood release from the damaged blood vessels forms a hematoma. Second, the internal callus forms between the ends of the bone, and the external callus forms the collar around the break. The third stage, it woven and spongy bone replaces the internal and external calluses. And fourth stage, you can identify compact bone replaces the woven bone, and part of the internal callus is removed and restoring the medullary cavity. So this is how when your bone got fractured. So these are the four stages it has to gone through so that your bone will be healed. Then coming to the functions, as we have discussed earlier, movement of the body, maintenance of the posture, respiration, production of the body heat, communication, then constriction of organs and vessels, and contraction of the heart. Then the three types are there. The three types of muscles are there: skeletal, smooth, and the cardiac muscle. Skeletal, smooth, and the cardiac. So the skeletal muscle, which is with its associated connective tissue, it constitutes 40% of body's weight. Okay, the skeletal muscle, which is a muscle which is connected to the, which is fused with the skeleton, that is called as skeletal muscle. Then cardiac muscle is found only in the heart, and its contractions provide the major force for moving the blood through the circulatory system. Cardiac muscle, it is present in the heart only. Okay, then last muscle is the smooth muscle. It found in the walls of hollow organs like stomach, intestines, and other uterus. Even you can identify in the urinary bladder as well. So in that areas you can identify the smooth muscle, which is responsible for the propelling of the urine. So through the urinary tract and mixing of the food in the stomach and the small intestine, dilating and constricting the pupil of the eye, and regulating the flow of blood through the vessels, through the blood vessels. Okay, these are the three types of muscles in the body: skeletal, smooth, and the cardiac muscle. Skeletal, smooth, and the cardiac muscle. So these are the four properties of muscular tissue. One is electrical excitability, contractility, extensibility, and elasticity. You just write down these four things under the properties of muscular tissue. Then skeletal muscle structure. What is the structure? So muscles are attached to the bones by tendons. Okay, muscles are attached to the bones by tendons. You can identify here that tendon is present. Muscle contraction causes most body movements by pulling one of the bones toward other across a movable joint. Okay, so muscle contraction occurs when you just flex your elbow, the biceps muscle, which is acting a major role in the flexion and also in the supination. Okay, these are the two movements carried out by this biceps. So this muscle pulls the tendon, and superficial muscle structures. Some muscles are present superficial, and some muscles are present in the deep. Okay, then coming to the muscle structure, if you take one muscle, so what are the structures are present? If you take a section of the muscle, we can identify so many bundles inside. So these bundles, they are called as muscle fasciculi. So entire muscle is covered by a layer called as epimysium. Inside the muscle, you can identify the bundles as I told you earlier. That bundle is called as muscle fasciculus. That is covered by a layer called as perimysium. And if you take one bundle, you can identify individual muscle fibers are present. Each and every fiber is covered by a layer called as endomysium. Endomysium. Okay. Remember, outside layer is epimysium. Inside the bundle is covered by perimysium. One fiber is covered by endomysium. Three layers. You remember. Then the muscle fiber contains several myofibrils. We are taking one muscle fiber and we are just looking into it. What are the structures are present? So there are several myofibrils are present. Myofibrils. A single sarcomere of a myofibril is composed of actin filaments. This blue color one is actin filaments, and this green color one is myosin filaments. Myosin filaments. Then coming to the joints and the movements. So the joints are classified structurally as three different types. One is fibrous joints, cartilaginous joints, and synovial joints. Fibrous, cartilaginous, and synovial joints. So coming to this, the functional classification: synarthrosis, amphiarthrosis, and diarthrosis. Synarthrosis means immovable joints. So example for this is skull bones and epiphyseal plates and joint between the first rib and the manubrium of the sternum. These are the examples for synarthrosis, means immovable joint. There is no movement takes place. Suppose if you take the skull bones, they does not move over here. Okay, so they will come under this synarthrosis or immovable joints. Amphiarthrosis means they move slightly movable joints. Okay, so that is vertebral joints. So in the vertebral column, we can identify all the vertebrae, they are lying one on each other. We can identify very slight movement over there. So they will come under amphiarthrosis or slightly movable joint. Then diarthrosis, it is a freely movable joints. We can identify the shoulder joint, elbow joint, wrist joint. These are all freely movable joints. Okay, they will come under the diarthrosis. Yes, here the types of synovial joints means freely movable joints and slightly movable joints. Slight movement where it takes place in the intervertebral joint. So the plain joints, this intervertebral disc or the disc present between the two vertebrae and the joint forms between the two vertebrae, that is plain synovial joint. There is very slight movement takes place. Then coming to the saddle joint. If you just look at the saddle which is present on the horse, in the same way saddle joints are present. So the example for this is carpometacarpal joint. Carpometacarpal, between the carpals and the metacarpals, you can identify the joint called as carpometacarpal. So this joint is called as saddle joint. Then the hinge joint which is formed between the lower end of the humerus and upper end of the ulna. Lower end of humerus and upper end of ulna. We can identify the hinge joint. Hinge joint. If we just look at the hinge of the door, as the movement takes place at the door, in the same way here also we can identify at the elbow joint. So we cannot move beyond extension. Okay, in the same way as you close the door and open the door. The next one is pivot joint. So the pivot joint, on one bony surface another bone is rotating, that is called as pivot joint. So example for this is proximal radio ulnar joint. It is also called as superior radio ulnar joint. So the radius is rotating on the surface of ulna. Okay, that is pivot joint. Then ball and socket joint. So ball and socket joint, example for this is the hip joint and also called as shoulder joint. So upper end of humerus is articulating with the glenoid cavity of the scapula, and here you can identify the head of the humerus is acting like a ball and the glenoid cavity of the scapula is acting like a socket, ball and socket type of joint. Then ellipsoid joint, ellipsoid joint. So there are two different movements takes place at the ellipsoid joint. Lateral movements, example for this ellipsoid is atlanto-occipital joint. Atlanto means atlas, first cervical vertebra is called as atlas, and occipital bone, between the occipital bone and the atlas we can identify this atlanto-occipital joint. Then coming to the range of motion, active range of motion is the amount of movement accomplished by contracting muscles that normally act across a joint. Okay, and passive range of movement is the amount of movement accomplished when the structures that meet at the joint are moved by an outside force. Okay, so that is about the range of motion. Then coming to this types of movement, what are the types of movement? So here we are just looking at this first image. This girl is moving her limb, upper limb, at the elbow. She's moving her limb upwards. So here in this moment is called as flexion, and if you just keep it in the normal position, that is extension. And then shoulder joint, coming to the shoulder joint, flexion is moving your entire upper limb upwards, that is flexion, and moving backwards is extension. And coming to this neck region, forward bending is called as flexion, backward bending is called as extension. Then coming to the trunk, entire forward bending is called as flexion, backward bending is called as extension. And coming to this other movements, one is extension and the flexion of the lower limbs. Coming to the at the knee joint, flexion of the knee joint means flexing your knee backwards. Okay, so moving your entire leg upwards and backward, that is called as flexion, and keeping in the normal position, that is extension. Okay, when you stand on the toe, when you stand on the toes, that is called as plantar flexion. When you stand on the heel, that is called as dorsiflexion. And keeping your entire this upper limb from the elbow joint to the hand, keeping it upwards, projecting it upwards, that is called as supination. Projecting it downwards, that is called as pronation. Then abduction and adduction of the upper limb, moving your entire upper limb away from the body, that is called as abduction. Moving towards the body, that is called as adduction. Then coming to this abduction and adduction of the digits of the hand. So moving the digits away from each other, that is called as abduction. Keeping near to each other, that is called as adduction. Here is abduction, and here you can identify the adduction. Then coming to this limb, medial rotation. What do you mean by medial rotation? Moving the upper limb towards midline, that is called as medial rotation. Away from the midline, that is called as lateral rotation. Then circumduction, rotatory movements. When you just look at the bowling in the cricket, you will see that rotation of the shoulder joint. That movement is called as circumduction, rotatory movement. And elevation and depression. So here you just observe this diagram. He's shrugging his shoulders. So in the elevation, he's elevating his entire the trunk. That is called as elevation. Keeping it normal position and pulling it down. That is called as depression. Then protraction and retraction, moving anything of the body forwards, that is called as protraction. Suppose if you just look at the temporomandibular joint, moving his mandible lower jaw forwards, that is called as protraction. Moving his mandible, retracting, his pulling it back, that is called as retraction. And coming to this lower limb, at the leg, at the ankle joint, keeping the sole towards the midline, that is called as inversion. Keeping the sole away from the midline, that is called as eversion. Inversion and eversion. Then lateral excursion to the right, lateral excursion to the right, and lateral excursion to the left. So just keeping the angle of the mouth laterally, and keeping the angle of the mouth towards right or towards left, that is called as the lateral excursion. Then counting the digits, that is called as apposition. Apposition. Keeping it normal, that is called as reposition. Okay, so then coming to the aging and the joints. So the bones, the gradual and progressive loss of bone mass after 30 years, and vertebrae collapse also it happens. Then functional changes, bones fragile and prone to fracture, vertebrae, hip and wrist. Then muscles, it increases in collagen and resultant fibrosis, and muscles diminish in size called as atrophy or wasting. Tendons loss less elastic. Okay, so the functional changes are loss of strength and flexibility, weakness, fatigue, stumbling, and falls. Okay, so these are the functions you can identify in the muscles, functions you can identify, functional changes you can identify in the bones. Okay, so that is about the musculoskeletal system. Okay, thank you, students. So in the next class we are going to see about the digestive system.